The City of Waterloo, in cooperation with its many active and inspiring entities, presents Heart for the City, a chance to hear and see what's going on in our city and to meet people who serve you, teach you, entertain you, help you, all neighbors and like you. Make this a city on the move. And now, here's our host, the Honorable Quentin Hart.
Hello everyone, and thank you for joining us on Heart for the City. I'm Quentin Hart, proud Mayor of Waterloo. And our city is blessed with hosting many world-class organizations, and on this show, we will look at two of them. Thanks to local foundation and philanthropists, the Boys and Girls Club of the Cedar Valley expanded to include the Teen and Educational Center, which opened on November 14, 2019. The mission is to inspire and enable young people to reach their full potential as productive, responsible, and caring citizens. They fulfill that mission with excellence. Also, we have a very essential county organization staffed with recognized experts, and it is the Black Hawk County Health Department. More about these extraordinary organizations and more about what is in everyone's mind, the coronavirus or COVID-19, all coming up after this.
Experience Waterloo. This is Tim Harwood. Each winter I travel with the Blackhawks to cities all over the Midwest. But there's nothing that compares to coming home. Let me invite you to experience Waterloo's vibrant downtown district with award-winning museums and locally owned restaurants, and enjoy exciting events all year long. Create your experience with places to stay, foods to savor, and things to see at experiencewaterloo.com.
Getting healthy has never been easier with a membership at Cedar Valley Sportsplex. Offering 80 free classes a week at all skill levels, there's always new and fun opportunities to grow. You never have to miss out on your favorites with our state-of-the-art facilities, featuring great exercise equipment, a track and field, pool, and 2 regulation gyms. So whether your game is football or pickleball, let the Cedar Valley Sportsplex turn your routine into something amazing.
After about 4 years, the Boys and Girls Club of the Cedar Valley opened their new teen center to the public in January 2020. The new building sits along 4th Street and provides additional space to the very active Lime Street location. The teen center is designed specifically to accommodate kids ages 13 through 18. And what is more important than our kids' education, welfare, and safety? And to tell us about how the Boys and Girls Club program benefits our teams, James Lee III, CEO, and George Phillips, Team Director. Welcome to Heart for the City.
Thank you. Thank you for having us.
All right, thank you for being here. But can you tell us, first of all, tell us just a little bit about yourselves in about 30 seconds or less. And I know you can go to the website and read all about you, but to the folks out there, tell us a little bit about where you're from as well.
Yeah, absolutely. George, you want to go first?
Sure. I'm originally from Illinois, a suburb of Chicago called Maywood, Illinois. Used to play college basketball, played some overseas basketball. Moved to Iowa about 10 years ago in the Cedar Valley. I've worked in remedial services, helping kids for a while. When I first moved here, I worked for another local manufacturer here in town.
Right.
And just being here, I met many great people, and I've been getting a lot of support from people who've accepted me into this community.
Okay, wow. And you said you formerly played basketball. You can end the argument right now for everybody that didn't watch the game. Do I still have handles? I ain't talking about making a shot. He said it. You heard him say it. I still got handles. I still got it.
You can pass it too if you pass it to me.
All right, Jay.
Well, I've been in the Waterloo community for a year now,
wow,
and really enjoy being here. I moved from North Carolina to where I was the CEO of a local club there for about 3 years, and my background is mainly workforce development and community college work.
Okay, all right, good. So what is the scope of the Boys and Girls Club locally and nationally?
The Boys and Girls Club, locally and nationally, is a youth serving organization where we work with our kids to become productive members of society. One of our goals is to make sure that they have a fun, safe environment to learn and grow with caring adults that greets them every day so that they have experiences that they otherwise would not have if they did not come to the Boys and Girls Club.
Okay. And, I remember even from personal experience, all of the times that I was on the Lime Street playing basketball, taking tutoring classes, and all the things that I've did. So, this is really an important session for me, having this conversation, just because of my history.
Absolutely. We're the ones that gave you your handles. Remember that.
You know what? For real. Really, for real. But how many youth are served in the Boys and Girls Club?
So in 2019, we served 1,028 kids as our registered membership. And then for community impact, we served 1,113 kids. So our impact is really huge for our community. Right. So a lot of kids come through our doors every day.
Right. And it's more than just playing basketball. There's some major programs there. Can you tell us a little bit about those?
Absolutely. So some of our programs, we have Passport to Manhood, which is our group mentoring program, Smart Girls. We have a Healthy Habits program. We have our homework help, where we want to make sure that our kids are academically successful. We also have our sports program, which is our triple play. So we have a variety of different programs that go along with our kind of free play recreation.
Okay. And so from that, why was the Teen Center established? What was the thought behind that?
The main thought behind this is that our Lime Street site has our younger kids, and there was really just a room that we held our teens, and our teens were overflowing, and we needed a bigger space to be able to, that they can be and make their own. So the community really saw the need to expand and support us when we said that we need to give them their own space.
Right. And how? So with the Teen Center, how does the Teen Center further the mission of the Boys and Girls Club?
Well, basically, we're catching kids at a age where they can start making decisions on their own, which is 13 years old. You want to start thinking about your future. And so, like our mission says, that we want to build and grow these people to reach their full potential and then become responsible, caring, productive citizens. So what we will try to do is, as James was saying, introduce programs that are going to help them just kind of wrap around what they're learning at school, what they're learning at home, and then we hope that we can just add to those things and just help them grow as individuals and then empower them to be able to do things on their own.
Right, and so the transition to building the Teen Center, because the mission you mentioned is consistent, build positive futures, lives. So I think that was because they were in one room at the old building, having more space and an opportunity to focus just on teens. That makes a significant difference, right?
Tremendously significant difference, because now our younger population, our K through 6 or 6 through 12-year-olds, they can have more room to spread out and utilize the facility. And then our older kids, they have the ability to then spread out as well and use their whole facility rather than just one room.
And so what is the cost for a child to attend right now?
So for 6 to 12, the cost is $30 for the entire year. That includes their summer programming as well as their after-school program. And for our teens, it's $10 a year. Our goal was to make it cost efficient so that we can remove the barrier of having to pay for a large amount to go and participate in these programs.
For an entire year. And so with the input from what you have right now, how was input given into the Teen Center? Were people able to say what was needed, or how'd you get input?
Yes, we did surveys for our community as far as what we needed in the Teen Center, but really we wanted to listen to the teen voice. So the teens that we had, we asked them what programs, what areas that they wanted to have, and then we kind of designed the Teen Center around that. One of the rooms that we have built that we're now outfitting out is our studio. The teens said they wanted to be able to make music because they're going to be the next Cardi B or whatever. And so we said, well, let's have a conversation about what is, if you can't be the next superstar, can you do the sound technician? Right. Can you be something else that is dealing with music? So we're working to build out that studio for them to explore some other STEM-related programs.
So how many additional youth can the center handle?
150.
150, wow.
Yes, unless you send the fire marshal by.
We need to get him a membership. He's probably watching right now. Yeah, I won't even get on him. So really quickly, what is the Summer Brain Gain? What is that, so folks know?
It's our summer learning program. What we've done this year for our Summer Brain Gain is that we're partnering with the Waterloo Community Schools to host a summer academy. So we employ teachers that are certified teachers to come in and do their academic success. They're working with the grade levels to make sure that the kids don't lose that summer loss that they experience. So we're working with them on that, and then in the afternoon we go and take them on field trips.
And so like programs that are unique, do you have any special programs, or is that one that you just mentioned?
Well, that's one that is kind of unique to the club. We also have our career and college exploration program, which we take our kids to explore some colleges and universities. We also look at some STEM-related careers and other careers, because not all of our kids are built to go to college, so we want to be able to provide them with some other outlets that they can still earn and make money.
Okay. And then just really quickly, what was the final cost of the entire teen center?
It was $2.6 million to build that building. Oh, wow. And that's just the actual building. That doesn't include the outfitting of the electronics, those kind of things.
All right. Well, I want to thanks to both of you for taking time to tell us about the exciting developments going on for the benefit of our youth. The positive results have been well documented, and thanks also to the members of your staff and volunteers who are striving toward fulfilling the mission of enabling young people to reach their full potential as productive, caring, and responsible citizens. So Mr. James Lee, the third CEO, and Mr. George Phillips, Teen Director of the Boys and Girls Club, I want to thank you for the bottom of my heart. And young people go through several stages as they grow and develop. And one of the most important is the transition from childhood to adulthood. And this can be an exciting time, but it can also be a critical time, because success can include academics and job readiness, as well as the ability to be financially independent. And it can also refer to the ability to become a positive member of society by avoiding a life of crime. But this process of healthy socialization is all important, and the Boys and Girls Club, working with youth from ages 6 to 18, is there to help. Nationwide since 1906 and here in the Cedar Valley for over 40 years, if you are looking to donate or volunteer to a worthy cause, you can't go wrong supporting this organization, which I call our organization, the Boys and Girls Club of the Cedar Valley. Continuing on, the work of the public health professionals, often behind the scenes, is important because such issues involve the well-being of individuals, families, communities, and societies, both now and for the future. And what is going on right here in Waterloo concerning the public health? We'll be talking to some well-qualified individual that is qualified to answer these questions after this.
When I ride my bike, I am always very careful and stay safe at all times. I always wear a properly fitted helmet. I check the safety lights in the front and back of my bike, and no matter where I ride, I keep an eye out for cars, even when riding on the sidewalk. This message is brought to you by Drive Safe Cedar Valley.
Welcome to the Waterloo Regional Airport. Waterloo Regional Airport is served by American Airlines with daily flights to Chicago O'Hare and connections anywhere in the world. Our airport offers convenient and easy access, fast security lines, $6 daily parking, and comfortable passenger waiting areas. Whether you're traveling for business or pleasure, fly ALO. Visit us online to book a flight or to check our flight schedule. Fly with us today.
The Blackhawk County Health Department, through collaborative efforts, planning, and policy development, promotes health, methods of disease prevention, and works to protect the environment for all Blackhawk County residents and visitors. With us is Dr. Nafissa Cisse-Egbuonye, who earned her doctoral degree in health education from Texas A&M University and her master's in public health from San Diego State University. A veteran of the public health field for more than 8 years, she has worked with different organizations conducting research, implementing health promotion programs, and advocating for vulnerable populations. Welcome to Heart for the City.
Thank you.
So, Doctor, can you tell us about how you came to your position with the Blackhawk County Health Department? I know Texas is warm, San Diego is warmer, and I understand the wonderful, incredible amenities here. But can you tell us how this journey brought you here?
Well, thank you. Well, for me, home is not something physical. I came to the United States from Niger. I was 6 years old. I was put on a plane and landed at JFK. So I've very early on, growing up, I've just been exposed to different environments. So it's really about the people, the community, and being able to feel welcome and having the necessary resources to navigate the community. And so so I was interested at Blackhawk County because I have a thing with hawks, and so I just applied.
All right.
Yeah.
Okay. Well, tell us about your vision, about the vision, or what your vision is for the health department.
I think one of the main things is to understand that public health has changed over time. Right now, the public health fields where we're currently at, we call it Public Health 3.0. Over several decades, we've been known for the direct care services, and that was because we needed to fill the gap. But right now in the community, we have a robust healthcare system. We have a FQHC, People's Community Clinic, Unity Point, Mercy One. And so the role of public health is really about prevention and population health. And that's the direction in which the health department is going.
And I'm going to have to read this question, right?
Okay.
But under the authority of Chapter 137 of the Code of Iowa, the Board of Health provides oversight to policy development, enforcement, education, and advocacy for the protection and improvement of public health. Who are some of the advocacy Board of Health members, and how do they relate to the health department overall activities?
Yeah, well, first of all, I have a great board. I have a really great board. I think each member advocates in their own way. We have board members that are coming from a very diverse field. We have physicians, we have an attorney, and also a reverend. We have a professor, and also someone that has been in the healthcare industry for quite a number of years. And so they each advocate in their own way.
So many think that the Board of Health only fundamentally deals with disease, but what other areas are in the scope of the health department?
So as you stated earlier, policy. We look at what are some of the policies that we need to implement, policies that promote population health, and also we look at factors also that influence health. So employment, for example, is one, or housing. It's very hard to tell people this is here's the way to eat healthy, and they don't have the resources. So looking at things from an upstream.
And within that, and taking a look at all those particular aspects, there are always things that come up and happen, but Radon. Radon. Do you have any concerns with radon in our local community?
Oh yes, radon overall in Iowa is very high, and it's a great concern. It's one of the leading causes of lung cancer. And so the health department, we have radon kits that people can come and purchase for a minimum fee so that they can test their homes for radon. But nationally, we're known to have high rates of radon.
And just even given the scope of our local health challenges, what is the strategy for filling the role of protecting and promoting public health?
At the core, there are three different angles. One, right now with the coronavirus, people might be more familiar with what we do in public health, but it's public health is really the heart of public health is in surveillance.
Right.
So we are always behind the scenes doing surveillance work. Sometimes there's small outbreaks. It's our role to really address those. The second thing is disease prevention, and disease prevention occurs where there's case investigation and treatment. That's us. And thirdly, health promotion, and that's where we educate the community about certain health behaviors to take on so that we can improve their health.
And what are some of the return on such activities, from childhood vaccines to women health coverage and prenatal care?
There's great return on public health. The number one thing is generational health, right? So, for example, it's public health that helped also eradicate smallpox. We are presently hoping to eradicate polio.
Wow.
And so there's only 3 countries in the world that have polio. And so you think about it from just generational health, and when you have healthy people, you have productive people. And so that's really the return on investment.
And what is the extent of childhood obesity in our local area and some of the negative effects on this condition?
Yeah. Childhood obesity is high in Black Hawk County, and it has a great impact because it's one of the leading factors for chronic health conditions. And that is one area that the health department will need to continue to work with local partners to be able to promote healthy eating behaviors and physical activity and exercise, and starting with the children.
And I know we just glanced over things like radon and childhood obesity, but could you tell me a little bit about mental health issues? And I know maybe we need to have another show about that, but can you tell us a little bit about that?
Yes, mental health has been on the on everybody's radar, from national to state and to local. I think predominantly it's understanding what's happening in mental health from the provider's perspective of limited providers in mental health, but also from public health. It's about educating on mental health. There's great stigma as it relates to mental health, and I think we could do more about really educating the community, and so that stigma is reduced.
And so you provide a myriad of different services. How is all this funded?
Well, that's a great question, but it's predominantly funded by property tax dollars and also our grants. We get grants from the state, and we also we're so fortunate also to have local foundations that support our work.
Well, good, and we're fortunate to have you. So coming up, we will discuss the pressing issues regarding the coronavirus. So you won't want to go away. You don't want to miss this. So don't go away. We'll be back in 60 seconds.
Connect to a high-demand career and earn as much as $50,000 a year. Industrial electricians and mechanics work behind the scenes. They install, troubleshoot, program, and maintain equipment, and are trained in electronics, hydraulics, fluid power, mechanical systems, and robotics. At Hawkeye Community College, you'll get the hands-on training you need. And in 2 years, you'll earn your industrial automation degree and be ready for a new career.
Sign up. It's a good program. You won't regret it.
When recycling, don't bag it. By avoiding bags and containers, we're taking a simple step towards being a better recycler. Many people think that bagging or grouping recyclables helps the process, but in fact, it's the opposite. By placing each item in the container individually, it allows recyclables to be sorted faster and more efficiently. This will ensure they become quality materials that can be turned into useful new products in our homes and communities. Learn more on how to become a better recycler at recyclingsimplified.com.
No matter what news media you use, the headlines will include the coronavirus disease 2019 or COVID-19. The World Health Organization has classified it as a pandemic, and Dr. Nafissa Cisse-Egbuonye, Director of the Health Department, is still with us to answer our questions. So, Doctor, what are some of the symptoms of COVID-19?
So the symptoms of COVID-19 are fever, cough, and shortness of breath.
Okay.
Those are the three main symptoms, and that is public to our knowledge.
Wow. That is several different things that we have to deal with. So which makes it very hard to figure out if it's the flu, if it is just that cough, or if it is the COVID-19. But if exposed, how long does it take to experience any of these symptoms?
So it can take about 2 to 14 days.
Wow. And we are in the midst of flu season, though, and what is the difference between the COVID-19 and influenza?
And so because of those symptoms being very similar to also the flu, one of the things that we're recommending for the differentiation between the flu and coronavirus is testing. And so people that have been in affected areas with coronavirus or have interacted or been close to those that have tested positive for COVID-19, they would need to go to their healthcare providers to get tested for that. And so it's also important to make sure that people go in and get tested for the flu as well, or ensure that they're taking the flu vaccine.
And you know, both of them that we just talked about, influenza and coronavirus, they're different precautions. Are they the same precautions in each situation? And you want to tell us about some of those things?
Yes, they are the same precaution for these two diseases. And so the main thing that we have been pushing out and we continue to emphasize is the washing of hands. And for 20 seconds, and so we've recommended for people to sing the ABCs or do the happy birthday song for 20 seconds.
Is that the Stevie Wonder version?
Yeah, good. And so I think both would work. Okay. The second thing is that when people feel sick, to actually stay home. So that reduces the spread of the disease. And the third thing is covering your mouth or when you're coughing, when you're sneezing and coughing, to cover your mouth with a tissue.
Right. And so that's also how how does it spread, or is that the same?
It spreads person to person, and a lot of times it's through the droplets when one is sneezing or coughing.
And I didn't wear my face mask today, but are face masks effective?
Yes. Well, let's hope first that you are healthy, because healthy people do not need to wear a face mask. It's people that are sick that need to. There are still particles that can go through face mask, and so it's really face mask is to prevent from the droplets of spreading.
Right. And now that there are known cases in Iowa, what are some of the plans you may have right now?
So again, public health is in constant surveillance and monitoring. We're in constant communication with the Iowa Department of Public Health, our healthcare systems, and so we monitor those cases or cases that predominantly impact Black Hawk County. So as of right now, those positive cases are not at Black Hawk County.
All right. And if you think that you have been exposed, or you believe that you have symptoms, you know, how and where can you get tested?
You call your healthcare provider. They are responsible for screening and to ensure that proper testing occurs.
Right, and you know, in these times and situations, there's a lot of misinformation that's taking place. And just to get a perspective on, are Asians the only one that can actually contract the virus?
Absolutely not, absolutely not. And that is stigmatizing. What it does is place negative perception on people. Rather than on the disease itself, so absolutely not.
Right, and we just want to make sure that we get the correct information out to people, because if you don't have the correct information, you may treat people differently and kind of miss your opportunity to not be infected. But question I have is, you said you just mentioned state and local and national. So what do you have, dialogue? Is it emails? How do you work with?
We have dialogue. The infrastructure for public health is the way most of the recommendations, it comes from CDC, originates, and then it goes to the Iowa Department of Public Health, and then Iowa Department of Public Health pushes those recommendations at the local level. And then we work with our local partners, whether it's the businesses, the schools, the hospitals, to provide the necessary information based on their particular industry.
And it seems that few children seem to potentially be affected or have milder symptoms. How does that matter?
Yeah. So far, that's what it's showing. The coronavirus, COVID-19, is relatively new, so we're still learning about that. But based on studies and based on some of the just the data that we're seeing, it's milder for kids. It's impacting more those with underlying conditions in the elderly population.
Okay. And are the symptoms different than a rhinovirus or RSV?
Nope, they're very similar, and so that's why testing is key.
Okay. And we have had calls from businesses, and I have a couple of those questions right in front of me, but we've had calls from businesses asking if they should close, and or organizations asking if they should cancel events.
So right now, we're not recommending businesses to close. What we're recommending is taking the necessary precautions. So, for example, if there's events that are being held that can be postponed, we recommend that. The second thing is for businesses to be flexible with people that do decide that are staying home when they're feeling sick, to limit the requirement of doctor's notes, because then that inundates the healthcare industry. But to be flexible and accommodating.
Right. And in live cases, if they're ever found in Blackhawk County, will the health department recommend quarantines or closings? What role would you play?
So the health department's recommendation at the Blackhawk County will be based also on the Iowa Department of Public Health, but we will take the necessary measures to control the spread of the virus.
Right. And you know, in this last minute or so of this segment, if there's anything that you wanted to tell the public right now, whether it's repeating what we talked about, what is it that you would want to say to them?
I would tell the public that at this moment, it's also important that they play a role in preventative approaches. So constantly washing their hands, staying home when feeling sick, and really using the tissue and covering one's cough and mouth. That's really important for public health at the moment.
All right, all right. Well, thank you, Doctor, for this most informative session, both on the activities of the health department and the coronavirus, or COVID-19, and it's certainly been eye-opening. Dr. Egbuonye comes from a diverse background and is multilingual. She is accustomed to various cultures, which makes her eminently qualified to work with our own local diverse populations. The Blackhawk County Health Department convenes and engages interdisciplinary representatives from public, private, faith-based sectors, and marginalized community members to form an advisory group that leverages unique and culturally sensitive strategies to achieve health equity and benefits. And it goes without saying that the Blackhawk County Health Department and its affiliates are a valuable a tremendously valuable asset to Waterloo and all of the Cedar Valley. But don't go away. We'll be right back.
Experience Waterloo. This is Tim Harwood. Each winter I travel with the Blackhawks to cities all over the Midwest. But there's nothing that compares to coming home. Let me invite you to experience Waterloo's vibrant downtown district with award-winning museums and locally owned restaurants, and enjoy exciting events all year long. Create your experience with places to stay, foods to savor, and things to see at experiencewaterloo.com.
The COVID-19 disease must be taken seriously, and I can assure you that your government employees are taking every measure to minimize its effects. Recommendations are being updated continuously. For accurate information on the disease and what to do, check out the CDC website, and that's www.cdc.gov, or search the Black Hawk County Health Department. And please consider all the recommended advice from the qualified sources for the sake of yourself, your children, and others. Thanks. Well, that's our show. We welcome your suggestions and feedback. Remember to tell others that episodes are available for viewing from the City of Waterloo website, cityofwaterlooiowa.com, and search for Heart for the City. And be sure to like us on Facebook. Please join us next time. Thanks for watching Heart for the City. Until then, I think you will agree, it's a great day to be in Waterloo.